This is the Emergency Medical Minute, sponsored by Health One.
All right, good evening, everybody. So I was going to talk about kind of the way we treat esophageal foreign bodies. You know, it's pretty common that we see people with a food impaction, some steak or piece of chicken stuck in the esophagus. And, you know, we have a couple options for what we can do. Kind of the most definitive treatment is to call GI, have them scope the patient, either push it through, pull it out, take care of it. It's good because they actually get to look at the esophagus, see if there's underlying pathology narrowing. But, you know, it's not always convenient in the middle of the night to have the GI doctors and a couple of nurses come in. So we try some things. A lot of times we do a combination of, you know, soda, easy gas, some kind of carbonated beverage. Sometimes we'll do glucagon as a medication. The thinking behind glucagon was that it's a smooth muscle relaxant, and maybe it relaxes the esophageal sphincter in the esophagus and helps things pass. So, you know, do the things we do here work? You know, anecdotally, it seems like sometimes they work and patients have success, but what do the studies show? In terms of glucagon, which has been studied quite a bit, it probably does nothing and can definitely harm patients. So, you know, all the studies have shown it's no better than either placebo or what else you know, doesn't do much. And about 10 to 15% of the time, it can cause nausea, vomiting, retching, which are not ideal when someone has an obstructed esophagus. So glucagon has, you know, fallen out of favor, probably discouraged by most. Some GI doctors still might ask for it in the middle of the night as something to try. In terms of carbonated beverages, it's probably more benign with less complication. And there are some studies that show that maybe like 50 to 60% of the time it can be beneficial. So that's probably worth trying, you know, as long as somebody can, you know, try it. They sometimes work better if they drink fast and kind of like forcefully try and get down some carbonated beverage or easy gas. But the glucagon's probably not worth it. And most of the times, you know, if they don't have very quick success with drinking some carbonated beverage, the GI scope is, you know, definitive and the best thing. Any questions? Thanks, guys.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.